Hello and welcome everybody joining us this afternoon for WHO Europe's Twitter space. My name is Banu Patnagar. We are in Tel Aviv, Israel, at the 72nd session of the WHO Regional Committee for Europe. An informative and thought-provoking session on long COVID has just ended. And in Israel, we have with us Dr. Catherine Smallwood, Senior Emergency Officer at WHO Europe. And also joining us, hopefully online, are Kitty and Sammy McFarlane from the UK to talk about their own personal experiences with the condition, also known as long COVID. So thank you all for being here. So let's just start with the first most basic question. Dr. Smallwood, if I could turn to you, what is long COVID?
Thanks, Banu, and good afternoon, everyone from Tel Aviv. So, post-COVID condition, otherwise known as long COVID by many sufferers, or people also call themselves long haulers, is a whole range of symptoms suffered by people who have had either a probable or a confirmed infection with the SARS-CoV-2 virus. It's something that might be long-lasting, but lasts at least for 2 months. And we generally capture that after 3 months of the resolution of the initial symptoms. The range of symptoms that long COVID can display are things like fatigue, shortness of breath, cognitive dysfunction, otherwise known as brain fog, but many, many other things. So this is really a multi-system disease that presents differently in different people, and that's really important. What's important to understand is that the initial COVID-19 infection that people have may have been mild, it may have been severe, and it may have occurred in people who are young or old. So this is really a condition that affects a lot of people. And in general, we tend to estimate that between 10 to 20% of people who have had an acute COVID infection, SARS-CoV-2 infection, may go on to have long COVID.
So thank you so much for that definition. But now, as we actually have two people with us with firsthand experience, I would like to give them an opportunity to tell us more. Kitty and Sammy, it's a real pleasure to have you with us online. Can you tell us a little bit about your experience with long COVID?
Thank you for having me. I got COVID in March 2020. Initially, I only had a rough cold. However, 1 month after infection, I started becoming a lot more ill, blacking out, minor seizures, extremely fatigued, heart palpitations, and extreme dizziness. This all led me to 8 months in bed rest. And now, 29 months on, I'm still not better. I am on a wide range of medication, have to follow strict certain protocols. I use wheelchairs daily. It's a full-time job.
Hi, thank you for having me. Sammy McFarlane, CEO, founder of Long COVID Kids and mother of Kitty. We both have long COVID, as Kitty just mentioned. We got sick in March 2020, and as Kitty rightly said, it is a full-time job. We're still living with symptoms now. When we first developed symptoms, it started off with sudden chest pain, based on a sort of foundation of fatigue that had been left over from our acute phase of infection, and then the symptoms just kept coming and coming and are well reported now. Heart palpitations, temperatures, aches, chronic brain fog, extreme fatigue, and all the way through the last 2 years, we've had new symptoms that have been episodic in nature, some that have come and gone completely, and some new ones that continue to come now. It's a very challenging condition.
My goodness, it's thank you for sharing that, and it really does sound terrible, and I'm very sorry both of you are going through so many different symptoms. Could you tell me a little bit about, I mean, you've described sort of the onset of symptoms, but also your present condition, but could you tell me how you have kind of tried to deal with the symptoms in terms of recovery or rehabilitation, if at all?
So the things that we've done have been work with a naturopath to work on any mineral and vitamin deficiencies that we've had post-COVID. We didn't have them before COVID because we're both very into nutrition and had a lot of work with a naturopath before. So we know that specifically post-COVID, and also following POTS protocols, so postural static tachycardia protocols, so electrolytes have been very helpful. Having to learn to move slower. Pacing has been extremely helpful in terms of symptom management, trying to stop those sort of peaks and troughs of symptoms, but try and have life on a little bit more of an even keel, and rest, just not doing too much and knowing that it's okay to rest. That's been so important. We've also had some private treatment, which we're still working with, and some of these things have seen improvements in our conditions, including heart medication. But really, this is an ongoing process, and although we've seen improvement, that we certainly haven't found a cure as yet.
Okay, thank you. That's really informative. Maybe I can go back to sorry, was it Kitty? That I'm guessing you're still at school, or how has school been with long COVID?
I couldn't attend, so I go to college, and I really struggled to attend. Originally, I had to drop out for a while. I did homeschooling to try to get me back ready for my GCSEs.
Yeah, Kitty had to have her GCSEs. She took her GCSEs at home. She essentially studied and taught herself her GCSE exam material, and then had an invigilator at home, so she could go from bed straight to the exam, straight back to bed afterwards. And she's just recently started at college, which is a 3-day course, and it's really challenging because there aren't any accommodations that will meet the needs of her illness, and if she's unable to attend the 3 days, then unfortunately she won't be welcome at the college. So we're really working right now to try and help keep her in college by using wheelchair at school or at college to reduce the energy output that she has while she's there, and they've set up some other sort of protocols to try and help with her cognitive issues, but we're not quite sure how she's going to manage. We're hoping she's going to do really well, and she certainly did really well last week, but it's early days.
That's yeah. We wish you all the best, Kitty. It sounds like you're really rising to the challenge, and really hope that both of you affected by this sort of very new and mysterious condition sort of make a full recovery. And this is all part of why we're here in Tel Aviv, is to give a platform to people like yourselves, but also to bring the scientists and policymakers together to explore how we can be better at both diagnosing and treating this condition. So, Dr. Smallwood, if I can come back to you, do we know anything more about how many people are affected by long COVID? And usually, how long does it take for patients to recover? Obviously, Kitty and Sammy are still having symptoms like 2 years in.
So, Kitty and Sammy, it's really great to hear your experiences and that there is progress on your side. And I think that's something that we hope will progress even further. In terms of the overall burden of disease that we're looking at, we still don't know, because this is still a condition that is under-recognized, under-reported, and the understanding we have of it is still too poor and not sufficient enough for us to really capture what's going on. So we have to rely on best estimates. And based on the work of our WHO Collaborating Centre, the Institute of Health Metrics and Evaluation, we've established or estimated that approximately 17 million people in the European region will have experienced long COVID in the years of 2020 and 2021 only. So that's not counting this year. And we have to remember that this year is actually when in the European region most of the COVID-19 infections have been recorded. So that's likely to be much higher. So there's still a lot to be learned. And what I would also say is that there's still so much for us to learn in terms of how people can access care, how they can report. What happens? Will they have to go shopping and see different specialists, or will we be able to put in place systems that actually take the patient as the center and bring the relevant medical professionals around that one patient to be able to provide integrated care? And this is really what we're working for. We heard today a lot of frustration on the side of health professionals who like to very much put things in a very specific box and who like to have things with clear certainty. And as a new disease, this is something that is posing a lot of challenges to our health professionals, to our policymakers in terms of putting in place the pathways that are needed for patients. So there's so much to be done here, and I hope that we can continue to work with patients, because patients have been advancing the knowledge. And in terms of the research, finally now, we're seeing some of the fruits of that research really validate everything that patients such as you, Kitty, and Sammy have been saying to us. So this is really important.
Thank you so much, Dr. Smallwood. As we're approaching sort of the end of our discussion, and it's been a really interesting one, I'd just like to turn to you for sort of a final thought on what can people do to reduce the risk of long COVID, and what can we as WHO do to support those who are living with this condition in the here and now, not in the future, right now?
So the best way to avoid long COVID is to avoid SARS-CoV-2 infection in the first place. And that's a sure way of avoiding long COVID. And we still have so much to learn about whether vaccination really provides additional protection there, but there is some evidence that there may be less of an impact, and we still need to find out more about that. So do as much as you can not to be infected with SARS-CoV-2, get a vaccination, get a booster shot if you're eligible for a booster shot, and then continue to apply those measures that we all know, and I don't need to reel them off, but of course, wearing a mask if you need to, getting good ventilation. If you are unlucky enough to think that you have signs and symptoms of long COVID, I would actually recommend people that one of the best sources of advice is from other long COVID patients at the moment. And so look online, be part of these groups where people are sharing their own experiences. But then also, wherever you are, try to seek medical advice. And I hope that wherever people are, that they can enter the health system and be provided with the amount of support. Pacing is something, for example, that Kitty mentioned and Sammy mentioned, that is now being very clearly established as being one of the really appropriate ways of managing and rehabilitating and being able to reduce the impact of long COVID. So pacing yourself, resting, making sure that you're not overexerting yourself, because that will likely contribute to the further deterioration of your health status. So these are some of the things that are coming out, but certainly seeking the advice of your community and your peers in that space, but also getting specific medical advice is very important.
That's great. Thank you so much, Dr. Smallwood, and thank you so much, Kitty and Sammy, for sharing your stories and for taking the time to speak to all of our listeners today. This is all we have time for today, but there is so much more to learn about this condition, and we have a lot of resources on our website, WHO Europe's website, FAQs, articles, stories, including Kitty and Sammy's stories. So do check that out if you can, and join us tomorrow here in Tel Aviv. We're still here tomorrow to learn about digital health, the opportunities and challenges, and why we need a regional action plan on digital health. So until then, thank you very much and goodbye.